Hi, so it's really great to be back here again. This is my second year at the BBS conference. I'm a psychologist by background, a clinical psychologist, and I'm also a researcher. And I started my life as a researcher with the team at the University of Birmingham, Professor Chris Oliver's team, who are particularly interested in trying to understand some of the behaviour, emotions and cognitions that people experience when they have specific rare genetic syndromes. Now, that's not saying that everybody with a specific genetic syndrome will experience certain behaviours, emotions and cognitions, but it's trying to think about whether we see certain patterns that might help us predict people's quality of life and well-being. So that was kind of my background and how I got into being interested in rare genetic syndromes, and how really I came to be here today to try to learn as much as I can about people with BBS and people's needs. So we've currently formed a West Midlands network between Coventry, Birmingham and Aston University, which is where I am now, to try to start to take that work forward within the West Midlands and the collaborations that we've been building with the clinics, with Phil Beals and Tim Barrett and people within the health service. Just to say, we have a website, www.findresources.co.uk. This website gives an overview of the types of research that our team has done in the past. And the research tends to focus on behavioural characteristics such as things like adaptive living skills, autism spectrum disorder, mood, overactivity, impulsivity, repetitive behaviour, sleep, social skills, and social anxiety as well. So those are kind of the broad areas we focus on. And over the next 2 years, we're hoping to bring onto this website BBS resources, which are tailored to the needs of people in this specific group. But our interest really, as I said at the start, is whether there might be a specific profile of needs in people with BBS, which is different to the profile of needs for people with other rare genetic syndromes. And we can see this when we look across genetic syndromes, that there are often these very characteristic needs in groups. So, for example, we've worked with a lot of children with Angelman syndrome, and children with Angelman syndrome have very characteristic, this characteristic drive for social interaction with parents and carers. So they're constantly seeking out the facial contact, being very close, wanting to be near people. That's very important to know about, because while that's a very positive characteristic of Angelman syndrome, also can sometimes cause some difficulties for children as they get older, particularly when that social contact might not always be available. And for people with Fragile X syndrome, we know that there is heightened levels of social anxiety, which used to often be mistaken for autism spectrum disorder in people with Fragile X. So by looking at this in fine detail in these groups, we've been able to really start to tease that apart, which means that we know now when we see people with Fragile X syndrome and they come into clinic, that we should be looking at social anxiety as one of the key things that might be important. Also, for another group, so that this last group I'll speak about and then talk a bit more about BBS, just ignore this graph really. What it shows is that for people across genetic syndromes where we see levels of behaviours that challenge, so sometimes I know this can be a problem for younger children with BBS, so things maybe like hitting out or temper tantrums, those sorts of things that can happen. We see that to be very varied across genetic diagnosis. So for some people with one genetic syndrome, that might be very high in that syndrome. In another syndrome, it might be lower. And in one of the groups where we know this is higher, so where hitting out behaviours are higher, which is a syndrome called Cornelia de Lange syndrome, what we find is that those behaviours tend to be associated with the physical health difficulties in that syndrome. So they're often related to the reflux that's present in the group. So we know that by looking at the profile of these behaviours and then trying to work out what causes them, we're in a much better position to be able to support people. So we started with this question last year of whether we can focus a bit more on the kind of emotional, behavioural and cognitive needs of people with BBS. and whether we can look at literature that's already there, so what's the research that's already been done to learn something about this, but also to speak with you all here to find out what you've noticed and what your research priorities are in this area, to see whether there's specific things that you want us to focus on. So in terms of the literature review, we had a very, very keen and eager student. So we are indebted to all of the students that we have working in our team because they do so much of the research. This is Julie, and she did a review of all the literature so far to find out about specific things that might be difficult in BBS, many of which we've heard about today. And the things that came up most often were things like people preferring a preference for routines, people sometimes being quite repetitive or obsessional about things, which can go in people's favour and can actually be harnessed, I think, in terms of sports and that kind of wanting to be really focused at something. Sometimes that obsessional drive and nature can actually be a really positive characteristic, but also can sometimes cause difficulties. Social communication difficulties for some people, and the mood and anxiety disorders that we've heard about already today, as well as those emotional regulation difficulties. And hyperphagic behaviours, that's the overeating that people mentioned earlier today, that's often a difficulty for people with BBS. When we asked you last year, so we spoke to 16 family members and we did 2 focus groups with the adults with BBS to find out what was important to them. We find almost a really similar, consistent pattern of things that are coming out. So it's that anxiety and low mood, emotional regulation, and particularly people with BBS were describing how change is a really difficult thing and being able to be flexible in situations, which could be related to the environment, it could be related to the sight loss over time, but that was something that internally people really felt that they struggled with and managing those changes, as well as sleep, the quality of life, and making friends. So from that, we're interested in there's lots of work going on thinking about some of the biological mechanisms that might underpin some of these behaviours. But we're also interested in looking at some of the cognitive or thinking styles that might be associated with low mood, anxiety, emotional regulation difficulties. Because there's lots of evidence as well suggesting that those things can sometimes predispose people to develop some of these difficulties. And it's certainly not the case that everybody with BBS develops these difficulties. So what is it that means that some people are doing really well, some people are not doing quite as well, and can we try to understand that? So we applied for some funding. So we've got a group of very experienced clinicians and researchers together. I've been working across the clinics to get the ideas together for a grant application to look at this in more detail. We applied for some funding and we had some success. So the Bailey Thomas Foundation have funded the research for 2 years, and that's going to fund a researcher to work on these specific questions for 3 days of their week. They will be focusing purely on BBS, thinking about well-being, emotion, cognition, and behaviour. So what will we be doing? Well, you can come out to the University of Birmingham, you can come out to Aston University to take part in the research, or one of our keen research assistants will be coming out in their car and can come out and see you at your homes. We've got some people at the back who are going to wave, just because they're going to be useful later on. Please wave. We've got Ed, Amna, and Nyla. So these are our students that have been working up a lot of the protocols over the last few years. And it's people like Ed, Nyla, and Amna who are going to be doing a lot of the leading on this research and going out to see people. But essentially what we will do is we'll be doing really in-depth interviews around emotion, around depression, around anxiety. For younger children, we'll be doing play-based assessments to look at social interaction skills and how they develop, and the association with the sight loss and when that starts to happen. Do we see changes? How does that develop? And also we'll be asking these very specific questions around anxiety and looking at whether, if we ask people to do certain tasks and when we change the conditions, whether or not certain people show more of a response on those tasks than other people, and whether that could potentially predict which people go on to later develop anxiety. So those decision-making tasks will also use EDA, which is where we measure the skin reactivity, and we pass an electric current through the skin, and we look at how quickly that passes through the skin. That gives us an idea of how physiologically aroused, maybe how anxious somebody is at that moment when they're completing this task. Just to say, we're not going to be making people really, really anxious. That is not the plan. It is not the plan to come out and terrorize everybody in their homes. It's just going to be a very sort of mild problem-solving task where then we just look at these very subtle changes in people's physiology, which will help us learn more about how these difficulties develop. That's all I have to say. I've probably spoken for too long, and I will disappear.